Normally I'd be intimidated following talking ducks, but we have props, we've got slides, we've got production value for this segment. So, Dr. Palmer, at the James, you folks are using distraction therapy for kids. Can you just define distraction therapy for us?
So we define distraction therapy as any sort of multimedia that can keep a child's attention away from sort of the scarier components of cancer treatment and get their mind focused on something else so that they can make it through imaging or treatment or just being around a lot of adults. At least at our center, we sort of intermix the two, but to try to make them feel a little bit more comfortable at home and having other things around that sort of decrease their anxiety.
Now, is this mostly about their emotional health, or does this actually have an impact on their physical health as well?
I think it's very likely both. In our sort of studies, we look at distress and anxiety. We weren't able yet to show any sort of physical ramifications, but we do think that by continuing this sort of type of distraction therapy and making it more widely available, you can, throughout our hospital, in different steps in pediatric care, that you can actually decrease the amount of anesthesia or the number of attempts of placing lines or accessing them, which is a means of kind of delivering therapy, will actually have physical ramifications, because each time you put a child through those particular procedures, you're putting them potentially at risk. And so finding different ways of mitigating that risk will likely have physical ramifications.
Well, let's take a look at a couple of slides. You can walk us through what actually happens. So this is what? What are we looking at?
So this is our pediatric waiting room, and it's a large interactive screen that children each get their own bracelet and get to pick an animal that they want to be their buddy. And then this is one of our pediatric sort of rooms that we bring patients into with their family, and that also follows them. So they start out in this room. They can sort of play with the background, create trees, and play with their buddy. And then as they go through different stages of their treatment, the buddy will follow them in their induction room or in the sort of exam room. It goes with them everywhere they go.
And it's not just electronics, they have something tactile, something they can take with them, right?
Exactly. So they pick their buddy, and so we have a couple of the buddies with me, and so they can pick ducks or frogs, bear with me, or little bunnies. And so they choose which one they prefer, and then that buddy goes with them everywhere they go.
So they're not alone.
Right, so they're not alone through the therapy. It kind of acts as their friend, yeah.
You've been through this experience with your son. Your son was diagnosed with his illness when he was just 2 weeks old, is that right?
Yes.
So tell us a little bit about going through this process of having your son have to go through so many different treatments and being in and out of the hospital, and when you realized that something was lacking here.
So one of the things that I think is misunderstood is how long kids who are diagnosed with cancer or another serious illness are sick and how much time they spend in the hospital. So we're not typically talking about days or weeks, we're talking about years. And I think something I read recently was the average length of treatment is like 1,000 days or something. I mean, it's just an incredibly long time, and it's very isolating. And so for my husband and I, our son was diagnosed when he was 2 weeks old, but he actually never knew he was sick his whole life. He was normal and healthy for 4.5 years, and then he had to have a bone marrow transplant. And for 2.5 years after that, he never recovered. But in his mind, he was always somewhere on the path to super duper better. That's how he looked at it. And yet, at the same time, he was living in one hospital after the next. And regardless of where he was able to get great medical care. But there were no sustained services that recognized that he was a normal kid. And we recognized that the only way he was going to heal was if somehow or another he could get great medical care and also services that recognized that he was a normal kid.
Well, you dove in yourself when you started to realize that there was this missing element.
Yes.
Tell us a little bit about the kind of games and stories you made up.
so again, our son Henry was only 4.5 when he had a bone marrow transplant, and so he finished a year of preschool. He, won the trophy for his soccer team, and then we got in the car and we went on a road trip with his younger brother Jack out to Minneapolis. And again, they were just thinking we were going on a road trip. And then a couple days later, he was in an 8x10 room with white walls having chemotherapy after having just had radiation. And then he was going to have to swallow 26 pills a day. And we just thought, how are we going to make him do that? Like he'd never swallowed a pill in his life, right? He'd never had chemotherapy or radiation or been hooked up to a big machine. And so I was looking around his room thinking, okay, like I'm pretty creative, but how are we going to get through this? And I was like, oh, look, there's a magic closet in the corner. And Henry, I bet you if you take that pill, a Batman figure will come out of that magic closet. And so it turned into a game of how do we get him to adhere to the things that he really doesn't have a choice about doing, but how do we make it fun? And that magic closet ultimately became what is one of Hope for Henry's premier programs, which is our Super Path to Super Duper Better.
Okay. I want to dive in with you, Dr. Palmer, for a second. I want to get back to your story. Hearing you talk about your experience as a parent, how do parents react to this when they come with their kid, they're sick, the kid's going through radiation, and you start giving them a duck and a wristband?
Well, I think that's a really important question, because if a lot of it is with setting a stage and trying to get people comfortable with what we're doing and try to help them understand, help the parents understand. And so we actually have a lot of our nursing staff that reaches out preventatively. So before they even come to us, we kind of help the parents understand that we're going to give them these things, try to help them feel more comfortable, and walk them through the steps initially. Our hope is that we can start to use technology even in that sense, and sort of giving them videos or sort of virtual reality, giving them an understanding of what it will be like, both for the parent and for the child. But it is really important to make certain that we don't sort of give them these sorts of things and then they interpret it as, this is not something happy or funny, or, people can get upset if you don't walk them through the steps appropriately. That's true.
When you log on to Hope for Henry, it says, reinventing how hospital care for seriously ill children. What did you think needed the most reinventing?
I think the fact that kids who are in the hospital are children, and they're people. So they're not, yes, they're patients, but that they're not really defined just as a patient. And so the reinvention is really around bringing the magic and wonder of childhood to them, because their lives are disrupted for such a long period of time. And so what Hope for Henry does is fund full-time child life specialists who we place in the hospital to provide comfort and care and explain what's happening and work with people like, Dr. Palmer and everything that's happening in the different departments, but also to bring in professional athletes and superheroes and celebrate every holiday.
Let's take a look. We've got some slides of some of the Spidey.
Yeah, so we have Spidey Steve visiting a little friend on one of our superhero days. We have, on July 4th, we bring in members of the military. We have mascots visiting kids. And during these kinds of events, the kids really do forget that they're in the hospital, and they just get to be kids. And they might be hooked up to an IV, and they might be getting, antibiotics or blood products, but in these cases, they're also in brand new costumes trick-or-treating on Halloween with a bunch of princesses. So it's bringing normalcy, which is healing, and it helps fight depression and anxiety and make the hospital a place that they are looking forward to coming to.
Now, there wasn't the amount of tech that we have now when you first started this. So how fundamental was it? How sort of basic was it when you first started?
I mean, it was so basic that, and this is back in 2000 was when Henry had his transplant, that hospital rooms had network television, which didn't have any programming at all after PBS Kids ended in the morning. So there was really nothing to do. And my husband is a very creative guy, and he ended up learning that Sony was about to have the first portable DVD player, and he actually bought it direct from the company before it was on the shelves at Best Buy, because that's what is needed. And one of the things I think that's so amazing about what you're doing is kids are not in one place when they're in the hospital. They're constantly moving around. So interventions that are based just in a hospital room are not sufficient, because kids are in their room, they're in pre-op, they're in post-op. So having something that travels with them or that moves around the hospital, like visitors, is really important.
The portability of it.
The portability.
In terms of the tech that's developed that you need, I mean, who's developing it? Is it a series of doctors? Is it artists? I mean, some of the stuff is quite beautiful, or psychologists. Who is in the mix when you're developing these kind of things?
Well, I'll take for example, our hospital worked with a number of different technology companies, and the company that we ended up choosing for those interactive screens is a company called Potion that works a lot with art museums around the country. And so we really liked them because they were able to take the technology and make it fit in our space and make it sort of it seems as though it's seamless. So the child really never goes away from that technology. And so really we tried to look at it as a piece of art, but also something that can help with our children. We also had a number of psychologists at our nationwide children's hospital that were involved in the sort of the experience component, because we tried to bridge the gap between the Nationwide Children's Hospital and our radiation center, so that way it seems like the two hospitals kind of work seamlessly. So there's a forest, for example, in the main areas of our nationwide hospital. We brought that sort of thematic, there's pictures of forests everywhere throughout the children's areas of our radiation center. And so we tried to blend that in together.
Tell me a little bit about the expense of this. When you start talking about technology, you have to talk about how much it costs.
Oh yeah, and so that, I mean, the cost was quite large to begin with. It was a big investment by our department. We were lucky to have a number of benefactors in our community that were very much interested in this. And many of them were, you know, like you, were sort of parents of children that had been treated at our center that were saying, we can do better. And then started to put some money and raise funds. And then we were lucky enough through our hospital to work with a number of athletes through OSU. And so one of the larger sort of groups was the A.J. Hawk Fund, who specifically, his hope was to raise money just for technology for children so that we can actually create, you know, what we have now, but also kind of pioneer in other ways to make it so that it works better, works at home, and can really just be an all-encompassing experience for a child. Because it really resonates what you're saying with me, because it really isn't just about the 20 minutes that they're going to be with us in a room with us, or the hour that they spend in our radiation vault. It's kind of the entire few-month period of time that they're spending with us. And how can we integrate games, and how can we integrate the experience with them so that they really don't, what we hope is that they don't really notice that they're being treated, that the treatment occurs well, but they just sort of move through the experience and then can continue their life. Because that's what we try to bring in each time we treat a child is, this is occurring in your life, but you have a life outside of this. And we try to encourage that for the family, is that we understand that this is a big part of your life right now, but we still want you to be able to live and live well when you're not in the hospital.
You're nodding very...
Yeah.
Does this speak to your experience?
It does speak to my experience. I was nodding because the whole tagline for Hope for Henry is live well, laugh hard, because you can live well, even in the midst of what is clearly a crisis in your life. And it is up to providers, both on the quality of care side and on the medical care side, to come together to make that possible. And to make it fun even for kids to be in the hospital, to make it a place that they look forward to going to, even, as crazy as that sounds.
Well, if you have to go, you might as well look forward to
Yes.
going. You mentioned games and interactivity, and people are probably wondering what this box is. This is really interesting on a couple of different levels. Explain about the Super Duper Better box.
So this is innovative incentive program that Hope for Henry has developed. It's called Hope for Henry's Super Path to Super Duper Better. And maybe I'll ask you to hold this. And hope. So what we've done is work with our Child Life team to develop a game for kids that incentivizes them to adhere to their medical protocols. So when kids are first diagnosed, our Child Life team sits down with them and says, what are the things that are most frightening to you or that you anticipate as being most difficult?
I want to read these out loud. So this for $1, physical therapy and occupational therapy. This one says medication. This says shot. This says vitals and weights, and this says radiation.
Radiation is perfect, right? And so there are many challenges for them to choose from, and we show our Hope for Henry superheroes going through these different challenges. And then we ask the child, how much should you get paid every time you overcome this challenge? And they give us a dollar figure. And then they're paid in Hope for Henry bucks, okay? And concurrently, they develop a wish list of something or a number of things that they intend to swap their bucks for when they achieve whatever the financial goal is. So that goal might be an iPad at the end of their week of radiation and chemotherapy, and that iPad may allow them to keep up with their schoolwork or stay in touch with family and friends who are far away. Or it may be, and I love that you brought a little bunny, because one of the first patients who underwent this program was a little girl. She was 5, and she couldn't really count higher than 10 or 25 maybe, but it was by ones. And so every week she earned 25 $1 Hope for Henry buck, and she swapped those 25 for a stuffed bunny. And by the end of her months of treatment, she had a bed full of stuffed bunnies. But it showed her in a very physical way that she had done everything she needed to do, and she was better. And then she got to go back to the life that she left when she was first diagnosed. And so the program is totally adaptable and personalizable by patient based on the things that are most challenging for them, the amount of money that would motivate them, and the rewards that would, again, motivate them. So instead of having all the choices taken away, which happens when you're diagnosed, it gives them so many choices back, and it helps them be invested in their own well-being, and then rewards them for the difficult things they need to do. So it's taking behavioral economics, and it's bringing them to the pediatric space.
And it practically helps them adhere to their protocols,
which is
right?
That's
the whole
thing.
point.
Yes.
The other thing I think is interesting about this, and I shared this with you backstage, is that it's very forward-looking. It's very future. You're going to be here for a while. You were going to invest in yourself and be here. And that was a question we had talked about a little bit. The delicate balancing act between this is really fun, this is warm, this is good time, but these children are seriously ill. How do you walk that line and walk it with the parents who probably recognize it a little bit more, and with the kids because they're ill, they don't feel well, they're losing their hair, and we have all this fun stuff too. Talk a little bit about that balance.
I think that's a really tough balance to strike. And everyone's unique, and everyone's family is a little bit unique in terms of how you try to judge that. I think a lot of it is through experience and just knowing how to approach different people based on how they're interacting with other staff or interacting with our other oncologists. And so many times it's simple and easy, where they kind of get it or they want to participate in that. And that's sort of a personality issue, I think. But there are people that sort of are not quite there yet, or are struggling internally with how to reconcile sort of a sick child and what's happening. And I think a lot of it has to do with sort of their mental state and how are they coping. And so generally what I try to do is try to determine that early on, and then continue to work with our folks over at our nationwide children's hospital, because they have a lot of psychologists that help children, but also that help the parents separately. And so trying to find that balance is a lot of trying to understand where they are in the process. Because once they make it through sort of the earlier stages in coping, typically they're more ready and more apt to kind of participating and wanting to do some of the more fun things. But then some of the adolescents that I treat really just want nothing to do with little bunnies. And so they kind of will play, but we also have Xboxes and video games and stuff like that. to try to bridge the gap for whatever is really, try to tailor it to each child. What do they find fun? And every once in a while we get a kid that's really not interested, but we try to get things that will actually help them.
I'm gonna open up for questions.
Hi, I'm Diana Withrow. I'm at the NCI. I'm just curious if you have programs for the siblings. I know during treatment there can be sort of a chasm that grows between the patient and their siblings, and if you have, how you've integrated them into your programming.
That's a great question. So there are some families that'll come with like many children all at once. And what we do is we give them the opportunity to each have a bracelet and choose whichever animal that they want. And a lot of it's based on age, so depending on the age of the siblings, they can sort of interact together and try to get them both to play either together or kind of separately on the different boards that we have throughout the department. But as they get older, we can have one child playing with the board or other children playing Xbox. And a lot of times what ends up happening is they'll play the Xbox. And then the child will play that while their sibling is being treated or seeing us. Whatever really works. Or we have different areas that will play movies, try to distract the younger folks. The adults typically choose to sleep during that period of time. And so we have different areas for the parents to kind of just relax while we take care of everything else.
So for Hope for Henry, all of our programming, so all of the photos that you saw in the events that we have are open to all of the patients and their siblings and parents, and there are giveaways and refreshments, and there's no differentiation between patient and sibling. Everybody's included in everything.
How many hospitals is Hope
So
for
we're
Henry?
at 4 hospitals now, Children's National, MedStar Georgetown, Sinai Hospital, Baltimore, and Cleveland Clinic Children's, and we're expanding this program here to 5 new hospitals this year.
Any other questions from the audience?
Hi, Larry Schoen, Schoen Engineering. So I have a data question. Is there a data showing that across broad populations it helps children with either emotional health, compliance with the regimes, and even the outcomes of the physical ailments?
So we actually have a lot of anecdotal data, but we are working with Laurie Children's Hospital to design a study that's going to be launched this year to capture the quantitative benefits on kids' medical outcomes. So particularly around taking medicine and IV placement and port access, I think are going to be the focal points of that. So we should have that data within the year.
And I think it's a great question. I think the problem that we have as a community, at least in radiation oncology, is what are the right measures to use? Because we have a lot of measures that have been validated in surgery that aren't necessarily a tool that we could use in other areas. So anxiety tools, depression tools, and these things. And so what we've tried to do is modify these tools and start validating them in our radiation oncology environment. But we are trying to develop right now both augmented reality and virtual reality techniques that will try to validate some of these emotional and physical endpoints. There are studies at Stanford that have tried that already, but the problem is that they're all sort of patient-reported quality of life measures. So they're helpful, but they're not necessarily valid to be able to broadly use it everywhere. And so that's kind of the challenge, at least at the moment, is trying to find a meaningful endpoint that's been validated.
We've unfortunately run out of time. Thank you both so much. It was really interesting. Thank you for your work.